I'm Dr. Leonardo. Thanks for joining me. Today I want to discuss one of the latest innovations in non-surgical medical cosmetic procedures, and that is the vampire facelift. The vampire facelift developed from two different techniques. The first one being dermal fillers using hyaluronic acid, and the second one, platelet-rich plasma therapy or PRP therapy. First I want to discuss dermal fillers. Typically we use hyaluronic acid fillers like Juvederm or Restylane. Hyaluronic acid is basically a sugar that's highly polarized and attracts a lot of water. It's found throughout the body and it's perfect for any type of lubrication or shock absorbing needs. You can typically find this in joints as synovial fluid. It's also in cartilage and it's abundant in skin. So it's perfect in terms of sculpting the face. We typically inject Juvederm into the cheeks to create a lift. We also soften lines and creases within the face like the nasolabial folds. Juvederm and hyaluronic acid does have its drawbacks or limitations though. There's certain areas of the face, particularly the eyes and forehead, where it is unsafe to inject. Our concern being vascular occlusion. That's when you block off blood vessels, starving the local tissue, creating or resulting in tissue death or necrosis. Now we solve this problem by adding PRP into the equation. Now PRP is something I'm well versed in from my chronic pain management career. That's when you basically withdraw blood from a patient, centrifuge it, super concentrating the platelets, growth factors, and other chemical markers, harvest these components, and inject them into various tissue that need repair. So this is perfect in terms of medical cosmetics. We can apply the PRP to areas where we cannot inject Juvederm because it's from your own body. It's absorbable, it never forms granulomas, it's smooth, it's never bumpy. It's not permanent, but it can last up to a year and a half or perhaps even 2 years. It basically enhances and prolongs the effects of the Juvederm. It also creates better circulation wherever it's applied. So you're going to have improved skin texture and tone. And we're also going to regenerate new youthful tissue. Now for the procedure, after a quick assessment, we'll prepare the face, we'll cleanse the face, and apply a topical local anesthetic to provide numbness. We are not going to achieve complete surgical numbness, however, you will be comfortable enough during the procedure. Any discomfort should be mild and short-lived. We leave the topical local anesthetic on for about 15 to 20 minutes. That's the time that we need to prepare the PRP. We'll withdraw about 30 cc's, spin that out. While that is spinning, we'll use the Juvederm to sculpt the face. We'll come back to the PRP, harvest the components. We can collect up to about 4 or 5 cc's from the 30 cc's of whole blood. And we basically go over the areas where we injected Juvederm, and we can apply it to the other areas that you cannot inject Juvederm. If you're interested in the vampire facelift and you're in the Greater Toronto area, please contact me. The best way to reach me is through email, leonardomedicine@gmail.com. Again, that is leonardomedicine@gmail.com. I'd be happy to help you. Thanks for tuning in.